Hello, everybody, and thanks for joining us for today's LTEN webinar, The Post-Pandemic Salesforce, Improve Their Success with These 5 Selling Skills, sponsored by CMR Institute. My name is Tim Sosby. I'm Editorial Director for LTEN. It's my pleasure to welcome you to today's program and to serve as our host of the webinar. We're going to start here with some quick housekeeping items for you and then dive right into the content. We are planning a 30-minute session for you today. You'll notice your phones are on mute, so any questions you have, please do type into the questions module there on the control panel on the right side of your screen. Just type in your question as it's fresh in your mind, hit the submit button, and we will get the questions queued up for a later response. Today's webinar is being recorded. It will be available on demand in the LTEN Self-Directed Learning Library. We'll send you an email with a link to that recording, and you will be able to find it through the LTEN website as well. And speaking of finding things, as you leave today's webinar, a follow-up survey is going to appear on a separate browser window. Please do take a moment when you leave today and look for that survey and quickly share your thoughts with us. We produce these programs for you, so your feedback is always appreciated. And along those lines, there's my email address showing at the bottom of the screen. If I can help with anything, certainly don't hesitate to reach out. All right, everybody, thanks again for joining us. I'm going to go ahead and get the program started now. Let me turn things over to our moderator today, Brittany Conrad. Brittany is with Client Solutions with CMR Institute, and she's going to take it away from here and tell us about our other panelists. Brittany, thanks for joining us today.
Thanks, Tim. I'm so excited today to introduce you to our other panelists. I've had the pleasure of working with both of these guys for many years now. First, we have Jeff Taylor, Director of Learning and Development for Harmony Biosciences. Thanks for being here today, Jeff.
Thanks, Brittany. Very happy to be here.
We'll also be talking to Greg Adamson today, Executive Director of Medical Sales Training for Olympus. Thanks for joining us today, Greg.
Brittany, glad to be here. Thanks.
We have a quick 30 minutes today, so we hope to accomplish the learning objectives that are on the screen. We hope to cover which skills are most important to engage healthcare customers. We want to understand quick ways to update your curriculum to prepare your reps for reentry. And also, we want to apply the lessons that we've learned from the previous year to improve sales moving forward. So why don't we get right into it and talk about the reentry skills that your team needs to have to be effective. To begin with, the first two skills were so closely related, we wanted to talk about them together. They're engaging customers and asking insightful questions. Greg and Jeff, I know these skills are at the heart of effective sales, but I want to ask you how sales reps should engage their customers now that business is starting to go back to somewhat normal. What types of questions or messages, emails are going to get reps in front of customers and get their customers, most importantly, talking back to them? Jeff, you want to start?
Yeah, thanks, Brittany. So in terms of engagement, doctors, they always seem to be in a rush, thinking about the next patient. And I think a very critical skill, it's very important for the representative to get the doctor to focus on them in the moment. And I think they can do that very simply by clearly stating, be very specific and clearly stating their intent for the call. So the doctor's not wondering what's coming next. And saying something very simple like, I want to talk about 2 things today. It will only take a few minutes. And I think the specificity should help the doctor focus on what the sales professional has to say, at least for the moment. I'm not saying they have to be brief, but they have to be specific. And I think the sales professional can extend the call by asking really good, insightful questions. And insightful questions are more than just open-ended questions. When we train insightful questions, we train questions that are focused on a problem. And we call this leading with the need, lead with the need. These questions have to be focused on a problem that your product or service is a solution to. They have to force critical thinking or ask the physician to make comparisons. These types of questions tend to lead to very long responses by the doctor.
Yeah, that's great. Asking those questions really engages the customer back to what they're saying back to you. Greg, what are your thoughts?
Well, Jeff, I like what you said about physicians and clinicians. In the world of medical device, we call on those, and that's always the end user of our products. But, with materials management, other department leaders, service line leaders, and then even in the C-suite, here's what we are learning so far. They are looking for us to provide information. So if you want to call that like data and insights, they want to know what's going on in the industry, what are other hospitals doing. They're looking for those best plays that other companies or hospitals are running. They want to know that. And they want to have insightful questions that will lead to solutions for them. So they are really asking us to be a solution-oriented partner, and we use that term a lot, very loosely, partner, but they are looking for answers to help solve their problems from us as vendors.
Great, Greg. We'll move on to the next skill. Now we want to talk about a skill that will likely come up as members of your sales force are listening to customers talk about their challenges and hopefully asking those insightful questions. I'm sure we've all heard a lot about the importance of demonstrating empathy with customers, but what does this actually look like in practice? We know what empathy is, and by now we have a good idea of how important this skill will be for reentry. I've listed a few reasons on the screen, but I'd like to ask our experts for more detail on why this skill is so important in our industry right now and what this actually looks like to reps. Greg, you want to start on this one?
Well, I think empathy has always been very important for us, and many studies by Harvard and other places have shown that it's one of the top 2 or 3 reasons reps are successful or not. But I caution everyone, Brittany, not to confuse that with sympathy. As hospitals are coming out of COVID, and they're not all the way out, they still have COVID patients in there, but as they go back to whatever their new normal is going to look like, they aren't looking for a sympathy party. I mean, they don't look for that, like, let's feel sorry for them. They, again, want us to understand what are their needs coming out of COVID. So they have operational expense, they'll have all their capital expenditures, and we are going to need to be in tune with that. And that may have gotten out of order. There was always like a nice cadence with capital and operational budgets, but that may have gotten out of order, and they're going to expect us to come up with unique and innovative solutions in terms of financing so they can get the necessary equipment to treat their patients.
Jeff, what are your thoughts?
Yeah, so I think, you know, the first thing that comes to mind for me with things returning to normal is that returning to normal probably is not equal to running smoothly for all offices, right? So we're returning to normal in the sense that we're going back and seeing, you know, physicians in offices physically, but that doesn't mean they're running the same way they were running before the pandemic. They may be running with less staff. They may be running the office with new staff. So all these things have to be considered by the sales professional. And I like to think that the biggest skill around empathy is going to be awareness, you know, situational awareness, emotional intelligence. And I think they need to seek to understand first about how their offices might be running differently than before the pandemic. Once they understand this, they have the opportunity to reintroduce or reposition products and services that an office may have not had a need for or been open to in the past. So I think that's one big consideration. And I think most importantly, sales professionals need to represent solutions to problems, not just represent a product. So we go and we're very product focused. And as Greg was mentioning earlier, we need to be solution focused and focus on problems that our product is a solution for. And finally, I think, you know, the sales professionals need to speak positively about what they're seeing in an office, meaning they don't walk in and say, wow, you guys are really busy today. Things are really hectic around here. You must be going crazy. They need to create a positive mindset for the office and say something like, wow, you guys are running very smoothly. I can't believe how well your office is running, and create a mindset that doesn't, you know, add to the hectic pace of the office and doesn't create their presence as being a problem, but more of a solution.
I love that, Jeff, because it's acknowledging how they're feeling, but also strengthening that relationship when they go back to in person. So using empathy as a way to strengthen their relationships. Okay, let's move on and talk about the next skill. Okay, let's talk about another reentry skill, identifying partnerships. Again, this is something that sales reps were hopefully proficient at before the pandemic. But what has the pandemic meant for partnering? What types of opportunities have opened up? Again, I've listed a few partnership ideas on the screen. Greg or Jeff, do these items hit home for you too? Can you tell us about a few of the biggest partnership opportunities for reentry, and maybe even some I haven't included in my list? Greg, would you like to start? What's been your experience, and where are you and your company seeing opportunity?
Now, in the world of Olympus, because we're a big scope company, right? So people are going to be, you can't get away from the top left one. Strategies for cost savings. What a great opportunity in the world of materials management or procurement, because they can just play any card they want right now and say, hey, we don't have any money. So they're going to look for us to be innovative, and they're going to look to have good products and service is going to be of a paramount right now. So cost savings will never go out of style. But I also think about this support for an influx of patients. I mean, the government deemed things like essential and non-essential. Well, there's been a lot of great campaigns I've seen on TV, not by our company, but just in the industry, saying, hey, cancer doesn't wait, or another disease state doesn't wait for COVID to end. So there's been a lot of backup, if you will. And there's going to be this large influx of patients who will come. And it's going to be up to us. So they're going, all they're going to sudden going to be, there may not be enough equipment, there may not be enough supplies, and they're going to expect us as vendors to be on top of that and help them to anticipate this rush of new patients that will be coming through the doors.
Jeff, what do you think?
So yeah, to pick up on Greg's cost savings, the biggest issue in our offices, we see rare disease. We're in rare disease, and it's more around resource and time savings, right? So how do you manage resources and time savings? And one of the biggest opportunities for us has to do with support for this influx of patients who've deferred care. So we're in sleep medicine. A lot of patients deferred, their sleep tests and their diagnosis for their sleep disorder because of COVID. And this is putting a lot of pressure on staff now that people are coming back in, for these tests. And in rare disease, it's all about prior authorization and benefits verification, and that puts a lot of pressure on staff. So we're supporting offices in that manner, and I think companies have a real opportunity here with their support programs that focus on benefits verification and the like to take some of the pressure off some of these offices. And another area that we're partnering with offices on is around the delivery of digital healthcare. We're doing so in the form of online resources for the doctor and also job aids for the medical offices as well.
I love those. So it's not only helping the patients, but helping that support as well for clinicians and staff. I'd like to note one of the partnership opportunities and see if either one of you could comment on that, about solutions to reinvigorate key service lines. What are some ways that your companies are doing that?
I think, again, I'll go back to what I said earlier, that everything's changed, right? So things are back to normal, but everything has changed. And, people have turned over, staff has turned over, offices are open, but they're operating differently. And I think all this change has created opportunity to bring back solutions to offices that maybe they weren't open to in the past. And I think this whole opportunity with offices opening up has created great opportunity for our sales professionals to reinvigorate, again, solutions or products and services or lines of products that offices weren't open to in the past.
Hey, Brittany, I would add on to there, the month of March was colonoscopy month. Now, people may be chuckling just a little bit, but that's a big deal. And it was for men and women. It was just a big campaign. And even in our own company, that if you work for the company, you get a free colonoscopy. So these are big things with bronchoscopes, colonoscopes, big events that need to happen. And there's a backup, and a lot of people just hit the pause button on their own healthcare during COVID. And heck, that could be people that are talking on this phone today or listening on the line today. And for each of us, it's kind of really up to each of us to make sure that we're taking care of ourselves. And then as a vendor, we got to make sure we're providing the hospital or ambulatory surgery center with the right equipment to take care of the patients.
Yeah, I love that, Greg. I think that combines a lot of the skills that we've talked about today. All right, now we'll move on to our final skill, which is about finding the right balance between in-person and virtual sales. In this new selling environment, the post-pandemic sales force will need to determine which approach or a combination of approaches will work best for their customers. Some customers will welcome in-person sales, while others will probably prefer to stick to telehealth even after the pandemic. I feel like a balance will be key for reentry. As part of our discussion, I thought we could talk about what our sales forces have learned during the past 18 months and how that will help them achieve balance moving forward. Specifically, I'd like to ask Greg and Jeff if there are any tips here that especially resonate with them, and also what lessons they would like to add to this discussion. Jeff, you want to start us off?
Sure, thanks, Brittany. Yeah, I feel that most importantly, the sales reps have to ask the customer if they have a preference, and not to assume that it will be all one way for one office or any given office. You know, can some customers be seen both in person and virtually? Can the sales professional leverage the virtual environment to better manage their geography? And I hope people don't give up on this virtual selling and this virtual environment. It has provided an opportunity to get better engagement with offices. And for my company specifically, we had an opportunity to access physicians in healthcare systems and institutions that were closed off to sales professionals because they were now available virtually. So I think there's a lot of opportunity to maintain that virtual, sales call environment in the future. And I think one really big lesson from the pandemic is don't assume what you think a customer will want or agree to. I know in the beginning of the pandemic, many companies and many people felt that doctors would never agree to get on virtual sales calls, but many of them did. And I think companies that embraced that virtual technology and virtual selling, they were rewarded for it.
Greg, what are your thoughts?
Brittany, in the world of medical device, it's very interesting. You've arrived when you're no longer considered the sales rep, but you're considered a consultant. And we always say that's the holy grail. That's the goal you're shooting for as a sales rep. So we'd like to think that a number of our sales professionals are considered a consultant and will be welcomed in. And for many of them, to be honest with you, there's never been a stop. We speak to many of our reps and there's COVID went on, but they were still covering cases. So case coverage will continue. I know that people down in the offices, like materials management, that, with rep tracks and all that, they're probably thinking, hey, let's slow down the number of people coming through. But if we offer value to the physicians and offer value to the hospital, I think it will continue to be an open door policy. I also think that we will use our virtual selling skills. We're going to use them because they're still difficult to reach, whether it's a physician or an administrator. And the skills that we use on how to write the effective email, how to get the appointment, what to do if you do get the appointment, those will never go out of style. So in some ways, this hiatus that we were on will help the overall skill level of our sales professionals.
Sure, I think so. And to make sure that the reps are prepared so that they do not waste those opportunities to reconnect with their customers. Because I think, no matter the approach, follow-up is going to be as important as ever. So do either of you want to comment on how we can engage the customer post-interaction, whether it be virtual or in person?
Sure, I'll start with that. I think that starts with the interaction itself, right? So how do we engage post-interaction? I think they have to plan for that post-interaction and ask for that post-interaction before leaving that call. So it's much easier to follow up with somebody that's agreed to your follow-up than trying to follow up sort of cold. And I think that's the primary skill. So it's part of the close. It's your follow-up is part of your ask of the physician or the office before you leave.
All right, that was a great discussion around those key skills that hopefully will help others start to brainstorm how their reps can see success as we start to re-enter. So now that we've discussed some of these key skills, I want to talk for a few minutes about what that might mean for your training curriculums. I know both of you on the line are passionate about training, so I'm excited for the audience to hear your thoughts here. Greg, maybe you could start. What are you and others at your company doing to make sure your teams are prepped for some of these things that we've talked about today?
It is a time of transition. Think about what happened to us in March of 2020. We were doing live training. I can remember literally being in a live class and sending people home on Thursday, and Friday we finished the class in a virtual setting. Never in my wildest dreams, Brittany, did I think that would happen. So it's been a tremendous transition for us. I've always been a big proponent of live training. And I can remember a couple of years ago thinking, almost dismissing virtual training. You can't make the same impact. I think I was wrong. I think when I watched our virtual training and the amount of our test scores and where they ended up, we were fantastic. And we saved a bunch of money on travel. And we learned a lot of skills, and now we're going to take those skills and realize there's a bunch of our curriculum that we can do virtual and then augment with live training. But just as an example, we were doing some things that were 2 or 3 weeks long in live training. That's a lot of time. And you go, you know what? Some of that anatomy, some of those other things, the Salesforce.com training, that could be covered virtually. So we've identified all the things that can be done virtually, do it virtually, and then add on anything that we need to do live. And now we're going to find out that it's not going to be a marathon, a contest of seeing who can survive 2 or 3 weeks long, but it may be 3, 4, 5 days with the rest of it being virtual. So blended and hybrid are the words of the day. That will be our style going forward.
Jeff, what about you?
Oh yeah, so I mean, microlearning, right? You can't get away from that. We had an opportunity during COVID to have more extensive, learning because people were sequestered at home. They had more time. But as we move back into this post-COVID environment, we need to go back to more microlearning and shorter iterations of learning. I like to use what I call the YouTube model. No one goes onto YouTube to watch a 30-minute video on how to fix a faucet, right? You want to find that 5-minute video or that 3-minute video on how to do something. And so I think our learning has to be the same way and broken down into chunks. So Brittany, as you're aware, our biggest effort in this regard is the microlearning program we are currently doing with CMR, where our Salesforce does one 30-minute course per month for 10 months. This results in a certificate in specialty selling at the end of the program. Very well received and going very well. And then in terms of value-based selling, our marketing teams are really good at this, about creating pieces that are value-based. But people have to remember that value-based is different, from a patient perspective versus a physician perspective. What's important for a doctor is not always important for a patient, right? So doctors want what's best for their patients, but they also want treatment options that they don't burden their staff with paperwork and the such. But that's very hard in a rare disease environment. Patients want access to the newest treatments. Patients who's been on a drug for 3 or 4 years and is finding that drug's no longer working, they want the newest treatment. So that value proposition for them is very different than what it is for the doctor. And any way that the sales professional can bridge that gap is going to be very important. We see a big use of job aids for this. The job aids are simple. They're easy to use. We see much higher usage out of job aids than we do our more in-depth selling resources. And I think that needs to be something going forward that companies focus on.
Sure, and making sure that the reps are knowledgeable before those interactions. So that's something I've heard you both talk about today, is capitalizing on the time that you do have and making sure that those conversations are meaningful. So I think, back to one of our first points about asking insightful questions. If you don't understand the marketplace or the customer, those questions are they're not going to come as naturally, right? So I think that, some sales reps might feel like they're a little bit out of practice and they'll need some resources that they can quickly refer to prepare them for meetings. So I think that that's great. And both of you commented on the need for, microlearning, job aid, things might look a little different. All right, well, I think unfortunately that is about all the time we have for today, but I thought it was such a great discussion. Please be sure to download the Reentry Guide in the handout section. This guide will lead you through challenges your reps are likely facing and then suggestions for trainings that could make a quick impact. Greg and Jeff, thank you both for joining us today and providing your valuable insights.
Thank you, Brittany.
Thanks, Brittany, for having me.
I'll turn it back over to Tim.
Well, Brittany, thank you very much. And Jeff and Greg, thank you for joining us as well. That was a great presentation. We appreciate our great discussion. We appreciate that. Folks, just as we're wrapping up today, I wanted to share just a few LTEN items with you quickly as we close out. I wanted to share some, I invite you to visit the LTEN website and the LTEN On The Go app, where you can access some of our available resources, our webinars, including the programs like this we recorded and available in the Self-Directed Learning Library, our virtual certificate programs, our e-learning lounge, microlearning programs, our LTEN focus on training publications, and our annual conferences and events. One of those microlearning lessons in the e-learning lounge is we have a new 15th module this year available around creative inclusive learning experiences. Certainly would love to invite you to check out that important topic and the others available in the e-learning lounge. Here's a quick look at the LTEN current events calendar, and so you can see what's coming up this summer and beyond. including our annual conference, will be a hybrid event taking place November 8th to 11th. Please do mark your calendars for that, whether you're joining us in person or online. We certainly hope to see you there. And finally, I'm going to invite you to join us for our next webinar. We'll be back here next Thursday, June 24th, with Candace Lankowski from Bristol Myers Squibb, talking about 30 minutes, 20 years, 10 tips, solutions for great leadership. Hope you can join us for that program. You can find out more information and register at this website, this address showing here. Here's the address for today's LTEN, for our self-directed learning library, where today's recording will be housed. So please do look for that within the hour. And finally, there's my email address. If I can help with anything, don't hesitate to reach out. Let me send final thank yous today to our speakers again, Greg Adamson and Jeff Taylor, to our moderator, Brittany Conrad, to our sponsors, CMR Institute, and to all of you for your time, attention, and participation. We look forward to seeing you at the next webinar. Let me wish you a good rest of your day, a good rest of your week, and we will talk to you soon. Bye-bye, everyone.